Millions of Americans care for their elderly or disabled parents or relatives at their homes.
And it can take a huge emotional and financial toll as caregivers often have to quit working in order to care for their relatives. But CBS 2's Dr. Max Gomez says now some people may actually get paid for their work. Doctor.
That's right, Maurice and Christine. The need is huge. Friends and families of people with Alzheimer's provided 18 billion hours of unpaid home care last year, and that's just Alzheimer's. Much more is provided to millions of elderly or disabled people. Now, a little-known law means those caregivers may get compensated for care.
Yeah, Camille.
This modest little apartment, barely a studio really, is home to 92-year-old Melvin Pringle and his wife, 87-year-old Maria Cotso. Melvin is retired from the NYPD but is now blind from glaucoma, and Maria is disabled after surgery. They live with their niece, Cynthia Diaz, an attorney who also served as a judge and as an ordained minister. She was their full-time caregiver for a year and a half.
It was quite limiting because there was everything that I had to, the care required that I take care of them first.
In fact, Cynthia had to step down as the first female Latino judge in New York State to care for her aunt and uncle, unpaid. Then she became aware of a provision in the federal Medicaid law that allows designated caregivers to be paid for their time.
The elderly loved one who has Medicaid can say, I have a caregiver that I am happy with, that I know and that I trust, and I would like this person to be assigned to taking care of my caregiving.
Melvin and Maria chose a deacon from their church. It can be anyone other than a spouse. The rate runs between $10 to $12 an hour for the amount of care Medicaid determines is necessary. So nobody's going to get rich off of this, but it helps.
No, it's a stepping stone to try to make caregiving and the families involved, their lives just a little bit easier.
It has made a major difference. I can now continue practicing law. I can continue doing the work that's required of me in terms of ministering and providing pastoral care.
Not to mention that her relatives are well cared for. Now, even though this is a federal law, the person receiving care must qualify for Medicaid, and those requirements vary from state to state. There is an exemption for parents taking care of disabled children, and again, it's not a lot, but it helps. It's something.
Every little bit
It's all
helps.
free. Exactly.
So difficult.
Yeah, it really is.
Thank you,
Thank you, Dr. Mack.